Good evening. Yes, and thank you all for joining us tonight. I want to welcome those of you in attendance here live, as well as those of you viewing on the live stream. I'm Greg Mizell, Associate Superintendent of Student Support Services, and I'll be facilitating tonight's panel discussion on the topic of mental health and student wellness. So tonight's discussion is timely because, as you will clearly see in a moment, many of our students continue to struggle with loneliness, anxiety, feelings of inadequacy, persistent feelings of sadness and hopelessness, and suicidal ideation. Events like tonight are really important because they help to eradicate stigma, foster more open dialogue, cultivate empathy and understanding, and extend support to individuals and families who are struggling. Before introducing you to our distinguished panelists, I'd like to acknowledge a few important people in our audience tonight. I saw 2 school board members. I saw our board president, Ginger Couvrette, as well as our clerk, Heather Plotsky. If you two could just be acknowledged, we give them a wave. There we go. We are fortunate in Poway Unified to have an active board. I wouldn't be surprised to see a few more slip in before the evening's ended. Appreciate you and your interest in this topic and your support. So I want to say that at the onset. I also want to acknowledge we have a number of people in the audience, principals who put in a full day, school counselors, teachers. We have student support services. We have a whole variety of staff. And so if you're a staff member, can we just acknowledge you? Thank you for being here. Yes, thank you for being here. So, and again, I know the days are long. I know the challenges are real. I know this is time away from your family. And it speaks to your commitment to supporting our students. So thank you for being here. All right, next slide. Let's introduce our panelists. Tonight's distinguished panel includes from San Diego County Office of Education, the one, the only Heather Nemour, Coordinator, Student Wellness and School Culture. She's been a regular here. I think we were just bantering, probably the 4th time she's been with me on a panel related to this topic. And when she starts speaking, you'll see why I keep inviting her back. We are also joined tonight by Katrina Reyes, a Program Manager with Lifeline Community Services, Catherine Torres, Program Manager with Lifeline Community Services, and from Poway Unified, our very own Cindy Hicks, our Emergency Preparedness Planning and Prevention Coordinator. Can we give this panel just a quick round of applause? Just a reminder, tonight's presentation as well as links to additional resources will be posted on our district website, and you can find those under Student Support Services. Okay, so why this topic? Next slide. We've convened annually the last several years now to talk about mental health and student wellness, and the short answer is our students continue to struggle with this issue. As many of you are aware, and this is a new slide, I haven't brought this out into the light, so this is the first many of you are seeing this, but as many of you are aware, we've been utilizing a universal mental health screener in the Poway Unified School District for several years now. And each year, once in the fall and once in the spring, every 4th, 6th, and 9th grade student takes this assessment. And every year, the #1 area of concern reported by our students, particularly at the secondary level, relates to not feeling a strong sense of belonging at school. During the 2022-2023 school year in particular, our students scored in the 0 to 19th percentile on this marker when compared with their peers nationally. Imagine that. In Poway Unified, right? On any marker that a student would be in the 0 to 19th percentile. So since this data has come to light, staff, and I'm so proud of our team, they've worked diligently to address the issue. And as you can clearly see on the graph, as our staff lean in, focused, and intentional, we're making steady gains. We're beginning to see the needle move. So from a low of 42% up this fall to 48%. I wish the progress was faster, and I wish the needle was moving, in a more dynamic and impressive format, but I'll take the gains because I think each gain is meaningful. Next slide. Interesting. According to the Centers for Disease Control, you can't make this up, right? We're in the midst of a mental health crisis in the United States. So that's not Greg Mizell saying that. That's not board members from the Poway Unified School District saying that. That's according to the Centers for Disease Control. Young people in particular are uniquely vulnerable at this moment. 2 in 5 high school students, or 40% as you'll see, report struggling with persistent feelings of sadness and hopelessness. This data was pulled in 2023. 1 in 5 experienced at least one major depressive episode. Okay, real quick. How many of you are living with a teenager? Just real quick, by show of hands. Yeah, good. All right, so this is different. Can I just say different from a mood? Right? Like this, we're not talking about that here. A major depressive episode occurs when any one of a combination of the following happens over a prolonged period of time. Depressed mood that lasts most of the day. Markedly diminished interest in participating in normal activities that lasts most of the day. Significant weight loss or weight gain. Insomnia, loss of energy, feelings of worthlessness, diminished ability to think or concentrate, and finally, reoccurring thoughts of death. Data collected by the CDC clearly shows girls and students who identify as part of the LGBTQ+ community are particularly vulnerable. Of interest in the 10 years leading up to the pandemic, students' persistent feelings of sadness and hopelessness nearly doubled among high school students. So this is not an issue, right, that's attached to the pandemic. This issue was rising well before that event. That event, under pressure, simply brought into the light what was always there and what was problematic. Next slide. Persistent feelings of sadness and hopelessness over time can lead some students to engage in suicidal ideation. And some percentage of these students engaging in suicidal ideation will eventually take the next step and actually attempt suicide, as we'll see on the next slide. Tragically, in the last 18 months in Poway Unified, 3 students, all in middle school, all ages 13 to 14, died by suicide. The suicide rate for young adults ages 10 to 25 has more than doubled since the year 2000. And according to the U.S. Department of Health and Human Services, suicide rates tripled from 2007 to 2018 for children ages 10 to 14. Given this, it should come as no surprise to you that suicide is the second leading cause of death for adolescents. After slight decreases in suicide deaths across all ages in 2019 and 2020, the number of individuals who died by suicide in 2022 was the highest number ever recorded in the United States. In Poway Unified, next slide, we've worked really hard over the last several years to implement a comprehensive school counseling program to respond more effectively to our students' needs. We've established assessment and care teams at each of our secondary schools staffed with trained professionals who provide multi-tiered systems of support to our students. We've reduced our student to care provider ratios in school counseling and psychology. We've trained staff for completing threat assessments, school threat assessments. We've added a clinical therapist at each of our middle and high school campuses. We've also implemented research-supported peer-to-peer suicide prevention programs, Hope Squad at the elementary level and Bring Change to Mind at the secondary level. We've worked hard in this district to get in front of this issue. Still, there are children attending our schools struggling with persistent feelings of sadness and hopelessness. Some are well known to us. Some are not. And to catch them all, we need your help. This is an all-hands-on-deck issue, and it's going to take all of us working together to support the most vulnerable among us. That's why we're here tonight, partnering with regional experts, parents, and community members. So now I want to invite my friend and one of our community experts, Heather Namor, to share with us, our students, parents, and families, support and resources on the topic of mental health. So please join me in warmly welcoming her.
Okay, thank you. Good evening, everyone. Thank you for being here. I remember a couple of years ago, I brought my high school daughter here, and she actually isn't in this district, but she was very impressed with this whole event, so that always sticks with me. Anyhow, I'm going to talk about just a broad overview. Actually, if you can go to the next slide. I'm going to give a brief just snapshot. Greg did a great job, so I'm just going to talk a little bit more about youth mental health. And then the bulk of my presentation, a part of that is going to be just mental health literacy, what is mental health, and us as parents, what are things we need to know? What are things we need to look out for? And how do I know, these behaviors or things that my kids are going through, is it just typical adolescent development and all the hormones and changes that they're going through? Because that's real stuff. Or is it something I need to pay more attention to? How do we know, right? Because often what those signs and symptoms of typical adolescent development can mimic what might be a mental health disorder. So it's so great you're all here tonight, and it's so important for us parents, I say us because I have a 15 and an 18-year-old, to understand a little bit more about mental health and have some common understandings and practices that we can all help guide our parenting. So I'm going to break down the resources for students, for parents and caregivers, and then just broadly enough for families. And Greg didn't mention this, but your district has been a part of a very large initiative in our county called COPES, which is creating opportunities for preventing and eliminating suicide. So your district, Greg, Cindy, the whole team have been instrumental in the success of this grant that has 31 LEAs in our county that are involved in, but it's all around suicide prevention. So much of what you talked about resonates, and then there's so much more you didn't even mention around just the critical training and supports that are happening in this district. So just wanted to add that. All right, next slide, please. So let's all get a shared understanding and definition of what mental health is. And the World Health Organization defines mental health as a state in which a person realizes their own potential, can cope with the normal stresses of life, and can work productively and fruitfully, and is able to make a contribution to their community. We don't always think of mental health being defined that way. We often think of mental health as something's wrong or it's those other people. We tend to, speaking of sense of belonging, we create this us versus them, and then we start othering, which reduces that sense of belonging. So much of the work around mental health and reducing the stigma around it is really normalizing it, and us adults getting real and getting vulnerable. And I can guarantee every person in this room is struggling, knows someone that's struggling, has someone in their family that is struggling with a mental health challenge. And it just is what it is, and it's okay. So another thing about this definition, is everyone has mental health every day. It's often ignored unless something goes wrong. So we also want to look at what mental health, when on good days too. It's about feeling okay or feeling good, but this is really an umbrella term, and it really captures everything from your daily mood to severe mental distress. And so with that, will take us to the next slide, which shows us this mental health continuum, which I love because it really shows that mental health exists on a continuum and it's always in flux. And you can, in one day, you can be thriving and, feeling calm and performing and sleeping well. And throughout the day, that can shift and change. And you can shift to being worried, sad, anxious, poor sleep, and even into a crisis. So knowing that there is this continuum, that 100% of people have mental health every day, and when we are aware of that and kind of realize that there's this continuum that's constantly changing, it also reassures us to know that it's okay to feel okay. It's okay to feel excellent. It's okay to feel very low mood, and to recognize that it's part of the human experience to have this ebb and flow of mental health. And so that's why it's so important for us to be checking in with our kids, be checking in with ourselves as us adults, because us as parents and staff members, we can't support our kids, our students to be well if we're not well ourselves. So this thinking of this mental health continuum, it applies to all of us. All right, next slide, please. So another great way to figure out, how do I know? Is this something more? Is this typical adolescent development? Is it something more? Is having a definition, a working definition. And in one of our trainings we've been saturating the counties is youth mental health first aid. It's similar to CPR, but it's mental health for youth. And so we work from this definition, from that training. In a mental disorder or mental illness, it's a diagnosable illness, and it's going to affect a person's thinking, emotional state, and behavior. And what's important to remember is that it's going to disrupt the person's ability to do these three things: to work or attend school, to carry out daily activities, and engage in satisfying relationships. And Greg talked about the depression and the different types of things that we're seeing among our young people happening. And so thinking about, being, down, or, a youth just locking themselves in their room for a few hours and then they're fine, that's different than these three things. And I like to refer to them as their ability to live, laugh, love, and learn, the 4 L's. So if it is impacting a student's ability to do these 4 L's, live, laugh, love, and learn, we want to pay closer attention. And so we always can kind of go back to this definition of a mental health disorder and think, is it impacting their ability to do these 3 things? Thanks. And, okay, so thank you. So again, as a parent, I think it's helpful to kind of break this down. What is typical adolescence and what is a potential warning sign? So first, withdrawing from family to spend more time with friends. Totally normal. My 15-year-old son, he really doesn't like to hang out with my husband and I very much anymore. But, I know he does because, on the weekends he'll come and be like, do you want to watch a movie together? Or do you want to go grab a bite to eat together? So we still have those little pieces of together time. But yeah, it's totally normal. He'd rather be with his friends. But withdrawing from friends, family, and social activity completely, that's definitely a warning sign. Wanting more privacy, another one that's very normal, right? Having to knock on my son's door, I can't just go in anymore, those kinds of things. But becoming secretive seems to be hiding something. So us parents intuitively know kind of when something more is going on. So that's another sign. Moving from childhood likes to teen activities and pursuits. So normal to not be into certain things that they were in middle school than they are in high school and so forth. But when they lose interest in favorite activities and they don't replace them with other activities or other pursuits, that's another sign we want to pay attention to. Being late to school because can't decide what to wear, absolutely, typical adolescent development. Unable to enter the classroom without engaging in a specific ritual. So maybe it's, I need to turn the doorknob 3 times before I enter. Those little things that can sometimes go under the radar are things to pay attention to. Staying up most of the night crying because of a breakup with a boyfriend, girlfriend. We those breakups are really harsh in middle and high school, and they're real feelings that they are suffering with. But when it turns into something more around bursting into tears for no apparent reason, that's definitely different. Sometimes feeling lethargic, having no energy. We have those days, thinking back to the mental health continuum, having low energy, low mood. But when it just is constant, right? It's more persistent, more severe. The world suddenly seems colorless. Like, we want to pay attention. And then lastly, you're in a panic before you take your exam, worried that you will fail, of course. And I always say when I train on anxiety is not all bad. There's good in anxiety, because anxiety reminds us, wait, if I'm feeling this nervous about a test, I'm feeling anxious, so I must need to study more or prepare myself more. Where a potential warning sign, sometimes your heart starts racing and you feel unexplainably dizzy, the more extreme signs of anxiety. So those are just some examples to give you some context to what might look typical based on everything our young people are going through, and then what might be a warning sign. Next slide, thank you. So just so important to be able to really open up the door to have conversations with our kids. And in how we do that really matters. And one of the things we always talk about when we train in youth mental health first aid is being able to listen non-judgmentally. And that's hard as parents, to take our beliefs and values out of the equation and truly just listen in a non-judgmental way. So what these kind of conversation starters are about are really not putting blame, starting a conversation with more affective statements, or when we say something like, seems like something's up, do you want to talk about what's going on? It shows that you've taken the time to notice something's going on and you care about them, and you're starting off with that as opposed to, you did this and let's talk about it. I've noticed you've been down lately, what's going on? So these are things, again, showing caring, that you've taken the time to notice. And this last one, it seems so simple, but how are you feeling is an important one, because so often we have these, whatever, fine, good, okay, and there's so many more words we can use to express how we're feeling. So we have this saying in our team, if you can go to the next slide, if you can name what you're feeling, you can better tame it. And so a part of that is first just identifying all the things that you're feeling, and not really being able to know is okay, but when you're able to see a visual like this and think, well, I'm more than, it's not just sad, I feel, miserable or depressed or inadequate, inferior. This is an example of how we can really tap into using our words and use it to identify how we're feeling. I always like to give the example of going to middle school years ago, and unfortunately a student died by suicide, and I was meeting with a group of girls, and they're like, we don't know how we're feeling. They couldn't even begin to express how they were feeling. But being able to share a visual like this, they were like, whoa, I feel this, and I feel that, and I feel that. And it helped just normalize it. And for them to be able to identify all the things they were feeling, they would then be able to tap into some of the strategies. So it's a good place to start, to just those check-ins and tapping into how we're feeling in those moments. Next slide, please. So what helps someone seek support? So with mental health disorders, it's so important to stay hopeful and focus on recovery, right? It's an ongoing process, and it's really different for each person. But what we know from research is that the presence of people who believe in and stand by the person who is in recovery makes a big difference. The ability to make their own choices about their care. So when we are, working with our, connecting our kids to services, or they're accessing, it's always so important to ask them, how do you prefer to be supported, instead of assuming you need counseling, you need this, you need that. So letting them be a part of that decision. Building protective factors. So all the risk factors that are out there for our young people today, we can buffer them with protective factors, which are things like a supportive family, eating healthy, sleeping, making sure that we have all of our basic needs met, having connections, caring relationships with others. Those are all protective factors that buffer those risk factors that are out there. And then, of course, peer support, which, examples of like Hope Squad. Those are peer support programs where we're lifting up mental health literacy for our youth. Because honestly, when we hear youth talk, they consistently say, adults are great, but we prefer to get help from our friends, from our peers. And so there's a big movement in our state to really lift up mental health literacy with our young people. Okay, so going into the resources. Next slide, please. So some of the resources for students I wanted to lift up and share with you. These are all, you're going to have them in the slides, they're on our website. If you can go to the first one, this is something our team at County Office of Ed puts together every year. and we do it with youth. So youth leadership groups in our county and across the state help inform these guides. And so this is really for middle and high school students. And we started this years ago during COVID when we had distance learning, and we're like, what can we do for students, because they are now isolated, disconnected, and they need support more than ever. And then it was really well received by our districts and schools across the county, so we do this every year. First page, all of the warm lines, the hot lines, the key lines that youth might need to reach out to for support and help. And so there's a QR code too, because some schools use these as a poster, and then they can just use that QR code. The backside are really ways that we can lift up mental health literacy for our youth. So being able to tap into the Never Bother Suicide Prevention campaign from the Office of Suicide Prevention and other supports. And then all of the icons on the bottom are team research and vets, kind of the best of what's out there for our young people. And so I'm going to talk a little bit about some of these later, but some of the things here, like the MindShift app, is fantastic. It's free. It's for students with anxiety, and by using it, they can tap into any kind of strategy or do a check-in with themselves. They can have calming activities. They can get steps to overcome specific anxieties that they have. So each of these apps are just filled with resources and strategies and go-tos for youth. All right, next slide, please. And then for our elementary parents, we have this taking care of a young person's guide. So again, just strategies for wellness, apps and videos, things that we can do as parents for our elementary age children to be able to really instill wellness for them. And then the next one is this pocket guide we share every year because it came from your district and it's shared statewide. So you should feel proud. A group of neuroscience, a neuroscience club from one of your high schools got together and thought, what can we do? It's during May, it's testing, a lot of stress, a lot of anxiety, and they felt like they needed something in their pocket that they could just pull out to help them. And this, they'll say, people will say, tap into strategies, but they don't tell us how to use they don't teach us the strategy, how to use it. So anyhow, this group of students came up with this coping with anxiety pocket card that is like, I brought some to actually give you. And they decided the grounding with the 5 senses was their favorite strategy. And so it breaks it down on what to do, how to tap into those 5 senses. And then the back of the card has the key crisis lines and suicide prevention lifeline and so forth on those. And so they're little just cards that are handed out across not only our county, but our state. So our graphics department at County Office of Ed partnered with them, and we came up with this, and now it's something that's reproducible. Is that a word? Reproducible for any schools that want to use it. So great example of youth-driven resource. And next slide, please. Oh, I'm sorry, I had a slide on that, so I did talk a lot about that. So this is anxiety. Canada's a little bit ahead of us with resources around mental health and anxiety, but this comes from their website where they have so much, but this app is evidence-based and it uses cognitive behavioral therapy strategies to help people learn more effective ways to dealing with anxiety. So healthy thinking, identify and deal with their unhelpful beliefs they might have from the ruminations. They have a chill zone where they listen to relaxation, mindfulness, or visualization audio. They have a learn and find out more about anxiety, quick relief stuff. So just something to check out. It's also on the teen guide that I showed you for the middle and high school students. All right, and now resources for parents. Next slide, sorry, that was my cue. All right, next slide, please. So an organization out of Stanford University called Challenge Success has done a lot of research and work around students with anxiety and the constant pressure of academics, and how so many of our youth are just not living a well-balanced life because of the heavy pressures of academics and other competing priorities. So some of their research really focuses on kind of what the students are struggling with. And so we know 95% are sleep deprived. And I will say there is a connection with sleep deprivation and suicide ideation. And when you think about not sleeping well one night and how that might impact you, think about just ongoing sleep deprivation and how that can impact ideation and our thoughts and beliefs and so forth. So sleep is very much connected to just mental health and wellness. 77% experience stress-related health symptoms, 63% constantly worried about academics, 62% say their workload is a major source of stress, and 47% are disengaged or simply just doing school. So their challenge success came up with, through their research and their scientists that work there, they came up with, if you can go to the next slide, please, PDF, because they wanted to know, in today's society, what is a well-balanced student? What does it look like? And PDF stands for playtime, downtime, and family time. And what the research shows is that if students have a minimum of 20 minutes a day of playtime, downtime, family time, that shows that there is balance and better mental health and wellness and so forth. So they have just such great resources for parents on their website. So I just wanted to share some examples of the tip sheet for how to embed PDF into the teens' day-to-day activities and for our elementary age students. And if you can go to the next slide, some other PDF resources is, a time wheel activity when you break down all of the different important pieces of their day, how we can kind of help them map or build their time so it's more balanced and structured between unstructured time and extracurricular and school and sleep. And so these are examples as well of some of the tools that they have for parents. So that is PDF. Next slide, please. And we do this every year. County Office of Ed partners with Rady's Children's Hospital and their Transforming Mental Health Initiative to hold a webinar series for parents, a mental health webinar series. And we currently just had our first one in January, but we have two more, one this month and one next month. And these are medical professionals, pediatricians, medical experts that are presenting on trending topics for parents that want to learn more about these topics around mental health. And then they end with a Q&A with the presenter so parents can ask questions and so forth. We also have on our website past years' webinar series. They're recorded so they can be accessed and viewed. So pretty much any trendy mental health topic you want to learn more about as a parent, you can watch the recording or attend one of these for this year. Next slide, please. And this is something new we just launched. It is a parent guide to mental health and wellness, because as a parent, it could be so daunting. There's so much out there these days, which is great, but how do we know what is what? And sifting through all of the resources can be overwhelming. So our team vetted and put together this guide for parents to be able to kind of have the best of what's out there. And one thing that's really, I'm going to talk about it in the next slide. One thing that's really been helpful is this parent test that can be taken through Mental Health America. I'll talk about in a minute. Other things on here are like the webinar series recordings, a suicide prevention brochure for parents on just things you can do in the home, what are things to look out for, questions you can ask your children, the PDF stuff I talked about, the teen guide, the young person's guide. We have a virtual wellness center that is for parents, for students, for staff, and it's just a virtual place to be able to tap into calming activities that can be a way to just decompress and disconnect and then kind of re-energize ourselves to go back to what we were doing. On the right side, these are just supports for parents. There, is a national parent hotline that can be really helpful when we're struggling with specific challenges as parents. There's the California Warm Line. Sometimes us as parents just need another caring adult on the other end to talk to, and that's available. Then the crisis text line, which is also available for students, suicide crisis line, and then we have the two new services that are available through the Department of Healthcare Services, which I'm sure you have heard about, but there are, first is the Saluna, which is for middle and high school. It's an app, and it's an app where students can access 6 free coaching sessions with a behavioral health specialist, with a coach. And they help them set goals, they help them with strategies, help them problem solve, and so forth. And sometimes to access mental health services, there's a wait. It can be very challenging to navigate the mental health systems. So this is a great resource to have in the interim to receiving services, or maybe it's something just a go-to that's all that's needed, is to have that behavioral health coach to support. On the flip side, the Bright Life Kids is for elementary students, and so that's actually parents would go, and you can do the same thing, have free 6 behavioral health coaching sessions with your child, or separate. It's up to you. But these are free resources that are available to all youth in our state, all parents in our state. And next slide. So just some broader resources for families. If you can go to the next slide, I talked about our virtual wellness center, just making sure you know that that is available to all. You can see things like gratitude, journaling, mindfulness. We have stress and anxiety, all kinds of different activities. And so each one, when you go into the box, it's broken down for children, for teens, and then for adults. And next slide. So this Mental Health America, as I mentioned, has this mental health screening. And again, in the interim, waiting to get services for your child or teen, this is another great way to just kind of tap in and take a parent test for your young ones. Your youth can take a youth test to see. My own daughter a couple years ago was struggling, and she did the youth test, and she found out she had anxiety. So she was able to take those results from this screening, and we took it to her pediatrician, and it was a great way to start a conversation with the pediatrician to get her connected to help in counseling. So it's all anonymous, and once you take the test and you get your results, it's very short. It's not a long, exhaustive screening. It gives you resources based on the outcome of the screening. And next slide, please. And the last is just a free resource across our state as well for mental health training. And so for us parents and guardians to learn more about mental health, what are the signs, what do I do for different situations, it's a free module self-paced training that us parents can take just to increase our mental health literacy and be in the know. So there's a link for that as well. And then the last slide is just my contact information. So reach out if there's anything I haven't shared that might be of interest. We have a lot more on our website, but those are kind of the top ones I wanted to share tonight. Thank you.
You can see why I invite her back again and again and again, right? So, I mean, just such a powerful slide deck, so many resources that people can access in their own time, in the privacy of their home, by themselves, with people, if they're attached to people who are struggling, right? Like there's a way forward is what I want to say. There is nothing more frightening than loving or being attached to a person who's struggling. There's nothing more frightening than watching someone spiral out of control. Nothing more frightening than that. And often, right, we find ourselves without the answer, or with the answer, but it's not getting in, right? Like, how do I get this in? Like maybe I think I know the answer, but it's not penetrating the heart. It's not getting through. And so I think it's really important, the story you shared, even with your own daughter. It's okay to access healthcare providers. It's okay to seek help from people on the outside, right? I know that it's scary. I know that maybe there's a concern that there might be judgment attached. But we have to move past that when the stakes are high, and waiting is not ever in our interest. The earlier we can get our students to services and supports, the better. So the delay that allows this stuff to root and to habituate, and it gets harder to undo, not easier.
Yeah, and you just reminded me that mental health continuum, what I forgot to mention, the earlier we can intervene, the more likely we are to prevent, what might become a mental health disorder from moving along that continuum. And so that's what gets me excited about working in schools, supporting schools, is because they're in the front lines seeing the kids every day, and you all are with your kids all the time. So we all are well positioned to be able to increase our mental literacy, learn what the signs are, and intervene early and prevent it from moving along that continuum. So absolutely. Thank you.
Yeah.
Oh, and I always say, asking for help is a sign of courage. That's really what it is about. It's courageous to ask for help.
Okay. We have a couple of other experts that have additional content to present. So Katrina and Catherine, I'm going to turn it over to you.
Thank you. So my name is Kat Torres. I am program manager for the Here Now program. So if we can go to the next slide. So we are here as guests, and thank you for having us here. Next slide, please. To kind of talk about what happens if some of those things happen, some of those warning signs, maybe, and also what happens when those can turn into safety concerns. So my program stands for Helping, Engaging, Reconnecting, and Educating. So we are a school-based suicide prevention and early intervention program. So we go into the middle and high schools throughout San Diego, and we are partnered with SDOIS through Prop 63, the Behavioral Mental Health Service Act. And what we do is we allow students to talk more openly about those struggles and if they're having those safety concerns. So I'm going to talk a little bit later about what that looks like inside the schools, but at first I kind of want to talk to you about some of things that you might see in a student, or things that your student might see in their friends, their family members, things like that, that might make you aware that there might be a safety concern. Next slide, please. So I'm going to kind of talk about some statistics, go over some of those warning signs. I know we talked about some of them earlier, but kind of emphasize a few of them. And then we're going to talk about those safety concerns. So what happens when, anxiety or depression is maybe left untreated and leads to maybe self-injurious behavior, suicidal ideation, or even attempts of suicide. And then I'm going to talk about recommendations about how you can help your student, what we have found in talking to, the professionals and talking to families to be most beneficial, and even from talking to students themselves. And then some resources at the end. Next slide, please. So I know that Greg already kind of mentioned this, but I do want to emphasize that suicide is the second leading cause of death for 10 to 14-year-olds and the third leading cause of death for 15 to 24-year-olds. So yes, that is a really, really high statistic. But the reason we also want to emphasize that is to let you know that the majority of people who die by suicide do show warning signs prior. Not everybody does, but the majority do. So if we can learn what those warning signs are, then we could potentially look out for that in ourselves, our family members, our friends, especially our students, and see how can we get this person help before it reaches that point. And part of our program is to try to reduce that number to get that statistic to lower. I also want to share that LGBT youth are 4 times more likely to attempt suicide, and questioning youth are 2 times more likely. I mention that because we also need to acknowledge that there are groups of people who incur extra barriers. Maybe there's added emphasis of, they might incur bullying or, difficulties at home with, the coming out process, or maybe even, just struggling to find who they are. And these things, without support from family, friends, we talked about protective factors and making sure that a student feels that there's support around them. When some students don't feel that support, it can increase their chance of attempting. I also want to share a myth that if there's a myth out there that if we talk about these things, if I am very open and candid about mentioning suicide, self-harm, death, those types of things, that it might be implanting the idea in people's heads. And people that weren't previously thinking about this before might think of it now. And sometimes that scares parents and individuals away from talking about this, because they're like, well, I don't really want to mention if they haven't already mentioned something, because I don't want them to think about it now. Now, we actually found the opposite is true. Just by mentioning to somebody, hey, have you felt so bad you've thought about wanting to hurt yourself, or you wanted to die? If they say yes to that, they were thinking about it prior to that. By you asking them, that wasn't implanting the idea. But what it is doing is letting them know that you feel comfortable asking that question, and they may feel more comfortable talking and actually answering that question. So what we find is the more that we talk about this topic, the more that we break down that barrier about talking about mental health, the more that students are able to talk about it and get those resources, and the less suicides tend to happen. Go ahead and go to the next slide. So what I want to identify is some more of those warning signs. Definitely, there's changes in relationships. I know we mentioned withdrawing from friends and family, but also those dynamics, noticing those changes, even especially with teens nowadays. You might notice that they are super quick to respond to texts, or they send, instead of sending a one-word answer, they send 15 individual texts to answer your question. And all of a sudden, changes in that dynamic. They're giving you one-word answers. They're leaving, their friends on red for, hours at a time, whereas it's like, okay, you normally can't wait 5 seconds to get out of class to text them. So little things like that can also be noticeable. Those mood changes. So definitely, a lot of people think that depression is only sadness, but that's not necessarily true. It can also present itself as, that withdrawal, but also irritability. So if you have a student that, or a child that all of a sudden just starts, snapping at people, just all of a sudden seems really angry and irritable, these are definitely things to be aware of. Now, I want to mention that with these warning signs, we're not talking about one day. We're not talking about 1 week. We say that if it's consistent for more than 2 weeks, then that might be the warning sign. It might be depression, because I pretty much everybody here has had a bad day at least once in their life, right? Sometimes we even have a bad week. But when to feel awful is now your new normal, that's when, okay, there's something going on. And also that may indicate that me trying to take care of it on myself, this is a student talking to themselves, me trying to take care of it myself isn't working. I might need that added support. And so that's where you can come in and be like, hey, let's find you that additional support. So that withdrawal or isolation, it is normal for teens to tend to, be in their room a lot more, or, just be like, I just want to sit on my bed on my phone for a while. That's totally normal. But when it's constant and you're inviting them out and they don't want to come out, when, there are new terms around. I try to keep myself more current with the terms here, but there's a new term called bed rotting, which the teens are calling it when you just want to stay in bed all day and you just don't even want to move, so much so that you almost just melt into the bed, right? So, in hearing that term, that kind of really expresses something that is concerning. If you don't want to move at all, and this is going on multiple days, that's concerning. Same with changes in sleeping and eating patterns in general. So everybody is an individual. Everybody's warning signs are going to be different. And this is why it's so important, because you as parents, you know your own children. And you can tell that little things are different than they used to be. Those of you who have multiple children, you know that even between them, there's a lot of differences. You could have one child that just seems to eat all day long and one child that just kind of nitpicks at their food. And that's both normal for them, right? Both of them are completely normal with that. But when you start noticing the big difference on the other side versus, a child that normally sleeps, like say myself, I can sleep like 10 to 12 hours at a time. I absolutely love sleep. I love naps. But then the warning sign on that would be, staying up all night, not being able to sleep, doing what, they're calling doom scrolling, where you're just scrolling TikTok for hours until that lady comes up and go, are you scrolling instead of sleeping? Those are the things that you want to be concerned about. Okay, that my child is not getting very much sleep. They have difficulty falling asleep. And a lot of times that can be a sign that their brain is just constantly running or worrying or thinking, and it's difficult for them. And then on the opposite side, we have people that can sleep like 5 or 6 hours, and they're totally fine to go. But then if they start sleeping, 10 to 12 hours, or they always want to come home and take a nap versus that wasn't your student before, that's something to be aware of and to, bring up in conversation. Hey, I've noticed this. That's definitely something that's different for you. And sometimes, you'll learn a lot about what's going on. Maybe it's something coming up that's concerning them, or maybe it's, I don't know why that's happening. And that's something you guys can figure out together. So we talk about the lack of interest in activities being that they don't want to do anything, or they're stopping something that was very passionate for them. So this is talking about if somebody's, had a love of guitar and all of a sudden they stop guitar club, they stop playing, they stop, then it's like, oh my gosh, this is way different. And again, this is a conversation to have, because we're not saying every one of these warning signs jump to automatically this person's depressed. We're saying, hey, this is different. And they might say, oh, I just, I picked up, I'm not doing soccer anymore because I'm really interested in baseball now. Or, my team of football left for LA, so now I'm a Padres fan. There are different reasons. And by having those open conversations with your student, those are things that we might find out. Is this more likely depression, or is this something that, this is a normal change for a teenager to have? And so there's also preoccupation with death or suicidal themes. And now we're talking about something that's brand new. Something that, all of a sudden they're writing things or listening to things, or you're overhearing a conversation and there's just a lot of dark things to it, or dark humor. Now, again, that's something brand new for them, because take, even myself in high school, I wore all black and listened to heavy metal. Was that my warning sign I had depression? No, because that was my normal. But take my bubblegum princess poppy daughter, if she started doing that and changing those themes, that is something concerning for me, because that is not how she typically is. So again, it's a conversation worth having, or something to look into. Now, we want to emphasize that everybody is unique and everybody is an individual. And so some of these warning signs, might be a little bit different for some people. And also, we want to recognize that some of these are also could be like stress related as well. So that's why the conversation is important to have. But these are things that you can kind of just look out for and be like, you know what, this just doesn't seem like you're normal to me. Go ahead and go to the next slide. So one thing I want to mention is co-occurring disorders. So this is kind of an honorable mention about substance use, because with depression, anxiety, things like that, substance use is more likely, something that they could turn to. And the reason being that well, they're trying to numb or trying to cover up whatever those negative emotions that they are having. We all know that not every teenager who uses substances is depressed, but we do want to identify if somebody is suddenly using substances where they weren't before, this could be their way of kind of trying to cope with their trauma, or trying to cope with an anxiety, or trying to cope with those negative feelings that they're feeling. And one of the things we emphasize in our program is that, well, that's exactly what it does. It just covers it up for a temporary relief. But once you sober up, your problem's still there, and then you have all these extra problems. So, we talk about, wow, you took your one problem, you tried to cover up, and now you have possible overdose, possible addiction, possible health concerns, possible problems with your family and friends, how you interacted while you're under the influence, financial concerns, because those things are not cheap. So there's all these extra concerns. So instead, we want to try to emphasize positive coping skills, things that they could do instead. And so that's something to explore with your student, is what things do make them feel good in a positive way. Next slide. So when, anxiety or depression or these negative emotions that come up aren't treated with a positive coping skill, sometimes individuals turn to negative coping skills, unsafe coping skills. And so one of those is self-injurious behavior, also known as self-harm. And so that's any intentional harm to the self, where they are trying to cause pain. So somebody that is anxious and is just kind of picking, and it's not for pain, it's just because they're anxious, that's not considered self-harm. But say they're doing it with the purpose of harming themselves because they feel they need to feel that pain, or they're trying to feel a release, or they have so much emotional pain that they're trying to take it out in a physical form. That is considered self-harm. And a lot of people only identify that it is cutting, but that's not true. It can also look like pulling your hair, scratching yourself, biting yourself, hitting walls with the intention of breaking your hand. Well, many students that aren't sure how to deal with an emotion in that instant may turn to one of these things if they are unsure of other coping skills. So what we want to say is not everybody who engages in self-harm wants to die. In fact, a lot of people that engage in self-harm are doing that as a way to not engage in something that would, or try to cope with a skill instead of having the suicidal ideation. And so it's not always tied with suicidal ideation. We also hear a lot, I think my child was just trying to, get attention. Sometimes that's true. But the way that they want that attention is it's a cry for help. So the best thing that we can do in this circumstance is to validate, hey, it looks like you're struggling, and it looks like you're not sure how to deal with that. Let's figure out how we can deal with those negative emotions. So if it's the attention that they're seeking, let's give them the attention as far as how can we work together to curb this, or to lessen these thoughts of self-harm or this engagement in self-harm. Next slide, please. So some of the warning signs that you might see with an individual who is engaging in self-harm might be unexplained, wounds, scars, bruises, things on their body that it wasn't there before, and you can't remember something specific that would have happened, especially if they try to make an excuse as like, oh, the cat scratched me, but you don't own a cat. Or, I burned myself in the oven, but the burn is all the way up here. That's pretty far for you to be sticking your arm in the oven. Things that don't quite make sense. Some individuals, they hide their self-harm, maybe in places on their body where you are less likely to see it. Or they start wearing long shirts or bracelets all the way up their arm, things like that, whereas that wasn't something they would do before. Now, I know that bracelets are super popular with teenagers, and so, again, not every teenager who has bracelets is self-harming. But again, if it's something new and they're covering up places, or They used to always wear tank tops, and now it's 100 degrees outside in the summer, and they insist on wearing long sleeves. That might be something we're talking about, or something we're worth checking to see. Is there something going on? Have you been feeling so bad that you've thought about hurting yourself? So these are definitely things that we want to be aware of. Also, some teens don't hide it at all. Some teens are very open, and they will purposely wear, shorter sleeve things or self-harm in areas that can be seen. And what we say about this is they are calling attention to the injury because they are seeking that help. That's their way of saying, I hope somebody notices this, and I hope somebody acknowledges that I'm really struggling right now. And so again, at that point, it's like, hey, I see that you're really hurting, and acknowledging that. Next slide, please. So what can you do to help with this? Definitely ask questions, but avoiding judgment. So as a parent, it's very hard, and children don't come with an instruction manual, right? But sometimes it can be very hard to kind of be that impartial party. But the best that you can do is to just try and be like, okay, I'm just going to take in what they're saying to me. And I'm still going to take it. And I'm going into this conversation understanding that they are hurting emotionally. And that's what you want to do, and ask those questions. How long has this been going on? What do you tend to use to harm yourself like that? Questions like that will kind of help you as a parent to figure out, okay, are there things in the house that maybe I need to put in my room instead? Are there things in the house where I need to make sure there isn't access to that? So those are ways that you can help, or asking them, hey, when this is out on, the counter or on the office table or whatever, does it make you have any further urges for it when you see it? And some individuals will say yes, and it's like, okay, then let's make sure that's put away somewhere, or at least in a drawer, so that you're not constantly seeing it and having that reminder. Helping them identify activators. So these are things that make them have these urges more frequently or more intensely. So like I said, one of them would be having that item that they self-harm with in front of them, right? Or maybe there are certain stressors for them. It's more when I take math tests, or it's more when I see this person, or I'm dealing with this bully, or, and helping them identify. That way we can figure out, again, you are a team. As a family with this child, you are a team. And so your goal is, all right, I'm not going to tell you how this is going to happen. I'm going to help you, because there are not times where you're not always going to be there, right? And so you want them to be able to be like, okay, I have these skills and I have this plan with my family about how to keep myself safe. Seeking that additional support. Definitely, this is something, parents, you do not have to do alone. So there are other resources to try to help you through this. Definitely the individuals at the school, social workers, counselors, teachers, but also in your community. You've got primary care physicians, you've got therapists, you've got all those resources that were provided, and I'll provide some more later as well. These are things you do not have to do alone. And yeah, you're not going to have every answer for how do I deal with this circumstance, but there are people out there who will have that answer that can help you through that. And then again, identifying supportive replacement behavior. So we can't just take something away and be like, you're never going to do that again, and then just expect, well, they're never going to do that again, without saying, okay, when you feel like that, is there something else we can do? If it's, out of anger, can we go beat the ever-loving stuffing out of a pillow or something? Or if it's out of sadness, can we journal about it? Finding what is it that helps them the best in that moment. And there are lots of resources for that as well online, about how to find, this is why I feel like self-harming, and this is what helps me through it. And so that's one of the things that our team does as well, is try to identify those replacement behaviors with families. Go ahead and next slide. So I'm going to move on to suicidal ideation. I do want to differentiate that somebody with self-harm is not always suicidal, right? Again, somebody with self-harm may be doing it in lieu of, I don't want to die, but I also am really upset and I don't know how to cope. So they don't always go hand in hand, but sometimes they do. And sometimes, if left untreated, that self harm can turn into suicidal ideation. So, suicidal ideation is the thoughts or ideas surrounded around death or suicide or taking your life. And it doesn't always mean that the person is actively going to die by suicide or kill themselves. But it is a huge warning sign, and it is something concerning because we don't want that to progress at all. So we want to kind of, as we mentioned, catch it as early as possible. And so, a youth who is feeling suicidal is planning on taking their life. So there are different phases of this, and that's something that our team specializes in kind of discussing with students. But also, there are individuals like counselors, therapists who can also work with you on this. Next slide. So urgent warning signs for suicidal ideation might be phrases. They might be super honest, right? You might hear a student say things like, I don't want to be here anymore. I want to die. I can't do this anymore. Sometimes they'll, I want to fall asleep and never wake up. Now, how many people here have heard somebody say that as a joke, right? That's oftentimes heard. But we encourage people to emphasize, hey, it's not okay to joke about those things because it could be something that somebody is dealing with. And so if your student, even if you think it might be a joke, it's okay to check in with them and say, hey, is that really how you're feeling? Because they could say, no, I was just like super embarrassed and like, I felt like, oh, I could die. Or they could say, well, kind of. And then okay, so when you joke about it, you're not really joking. Or somebody who jokes about it constantly. There's only so many times you can joke about something before it's like, okay, I feel like there's some truth to this. There are also kind of vague statements that students can make, like, I won't be around much longer. I'm not going to burden you anymore. And those, again, are things to check in on. What do you mean by that? Because, again, you can have that conversation and somebody could say, well, I just meant like I'm getting help on my math, so you won't have to worry about me and asking you all those math questions anymore. So instead of just assuming, that it's probably fine, one of the best things you can do is kind of get ahead of it and just ask, hey, what do you mean by that? So that we can see, is this an actual suicidal thought? Is this thoughts about them not being here anymore? Things that they also might say are all of a sudden a student or a child who gets really lovey and is not super affectionate, but starts, I love you so much. Or saying things like, I wish you the best for the future. Like, you've always been there for me. It's like, this again is out of the ordinary for this person. It doesn't sound like they plan on sticking around. And that's something we want to make sure of. Some other warning signs would be giving away their favorite possessions. So an individual is thinking about dying by suicide, may talk about, or think about giving away things because they figure, I don't need those things anymore. So may not be always something that is super valuable either. So it could be, the ring from grandma that somebody, really, really prizes. But it could also be like, oh, I'm going to give, Jason my Xbox and this person my phone. And, those are important things to a teenager. So also paying attention to is, okay, they're giving away all these things that were super important to them. So now in this virtual age, suicide notes or things like that are in many different forms, right? So there's the typical note that somebody could write, but you might also see posts, videos, things like that also act as kind of a note. A lot of times students are taking things onto social media, and that is one of the main ways that friends are identifying, hey, I'm concerned about my friend because they posted this. We do know that about 68% of people turn to a friend before an adult. So, when students tend to turn to their friends might even notice some of these warning signs before an adult is even notices. And that's why we also encourage, if your student knows anybody, any friend who has any of these warning signs, can you let me know, or let some sort of trusted adult know, so that we can get that person help. And then the last warning sign I want to talk about is attempting to obtain anything that would severely harm themselves. If there are things in the home that they've talked about or identified, or they're not an avid gun user, and all of a sudden they want to obtain a firearm, that's something out of the ordinary. That's something, okay, I need to look into why does my child want this? What is the purpose of this? Those large quantities of medication, I don't think you necessarily need those in your room. Let's keep them out here, or let's keep them in my room. So when you identify these things, or these warning signs, you can also acknowledge, okay, then this is what I can do about that. Next slide, please. So, my slide got all weird. Okay, so how can you help? If you're noticing these warning signs, best thing you can do is just be there for them. Physically, emotionally, mentally, just be genuine. I really care about you. I value you. I want you around. How can we help this? Focus your concern on their well-being. Sometimes, in kind of a panic, we can start to think of, oh my gosh, I need to do this, or what if this is leading to this? But staying there present in that moment with them and being like, I'm here with you. I'm listening to this struggle that you are having. And sometimes even just validating them, even if you don't quite understand it. I don't quite understand why this breakup is making those thoughts come up for you. It doesn't seem logical to me, but I can see in you that that is a real struggle for you, and that you're really going through something. It's really affecting you. So speaking with that empathetic tone of, I'm just here to listen, I'm here to help. And being direct and non-confrontational is one of the best things. So I'll talk in a later slide about how you can be direct. But the more open you are to talking about mental health, the more open your student tends to be. We definitely lead by example, and our children learn from us. So, definitely being there and asking the 3 big questions, which I think will be in the next slide. And then just, again, staying present. If you're in the middle of something and they say something that's really concerning, or one of those urgent warning signs, best thing you can do is, if you are able, to stop what you're doing and face them and be like, hey, I really want to listen to this right now. And if you can't stop, because we have really busy lives, right? Then let them know in that moment, hey, give me 5 minutes, because you deserve all my attention. And I need 5 minutes, and then we're going to sit down and talk about that. Even just acknowledging, like, hey, I want you and I to be in this conversation, instead of it's you, me, and the computer that I'm trying to balance with right now, lets them know, okay, I am the most important thing right then. And that can really, really help a child to feel validated and feel like somebody really, really cares at that moment. Now, if somebody shows one of those urgent warning signs, do not leave your child alone. Do not. So when we leave somebody alone, even if it's, I have to go grab my phone, or let me go grab your dad, or something like that, it can also lead to, maybe a rush of, oh my gosh, I'm panicking, and them hurting themselves. It can lead to, I've changed my mind, or maybe them fleeing because they're like, I said this, but now I'm kind of taking it back, and I don't want to be here. And, so we don't want that to happen. So ways that you can avoid that is, hey, let a sibling know, hey, can you go get my phone? Or even, let's walk. Can you walk with me while I come to get your dad? Or things like that allow them to still be with you, present in that moment. And you can let them know, I want you to stay safe. So, can you walk with me at this time? And things that just allow them to know that the reason I'm doing this is because I care and I want to keep you safe. Next slide, please. So talking openly about suicide. The more candid you talk about these things, the more openly you talk about them, again, the more open your student is. So one of the things that you can do, previous slide, I think, is to ask these three big questions. If you don't remember anything else, these three big questions are the big ones. So, plans means intent. This is going to get a lot of info for you. Have you been feeling so bad that you've been thinking about suicide? And if they say yes to that, you can ask them, your plans means intent. Have you thought about how you would do it? So they might tell you, hey, I've thought about this kitchen knife, or I've thought about using this. And an eyebrow razor is a really common one that we hear. So, you can identify what is it they're using, and then we can figure out, okay, how do I not have that within my students' access? So that's a really important one. What will you use? And so you can identify, oh, it's, this lighter, or this whatever, or this is where I'm going to get it. And then have you thought about when you would do it? So this is kind of talking to the intent. I thought about the last week before spring break. So you can make sure, okay, that last week before spring break, I'm going to make sure that somebody is with you so that you feel supported during that time. Not coming at it as I'm punishing you and making somebody babysit you. It's, I'm going to make sure you feel supported. So it's all about kind of that wording and making sure that I'm doing this because I want to support you. And then asking if they've ever attempted suicide before can also indicate that somebody who has attempted prior may be more likely to attempt in the future. Next slide. So reaching out for support. So I mentioned some of these before. You don't have to do it alone. There's the counselors and social workers at the school. Your primary care doctor, very big resource. They can help you with referrals if you need any sources. They can also administer some of those, mental health or mental status exams to see if your student is more at risk. Those crisis hotlines, which I'll give you. Therapy. And then the California Parent and Youth Hotline. This is, it's called For a Parent, and it's a really great resource for emotional support and resources for parents. Again, kids do not come with an instruction manual. So it's really nice to have somebody to talk through and be like, okay, these are parents helping parents out. And it is through the Department of Social Services. So they can help you with referrals to local resources as well. It's in English, Spanish, and other languages as well. Next slide. So just really quick, I did want to touch on what our team does. So with the Here Now team, we go into these middle and high schools and we present this information to students, staff, parents, and we also do lunchtime activities. So we present all this information, the warning signs for depression, how if left untreated it can lead to suicidal self-harm. We talk about bullying. We talk about not being a bystander. We talk about different coping skills, getting them connected. And then we provide check-ins. We provide a resource that at the end of the presentation, they can even mark, do they have an immediate safety concern? We'll see them immediately. Do they want to talk about themselves? Do they want to talk about a friend? Do they have a question? Or they can mark, I don't need to talk. But we still check in with students that, maybe other staff or maybe their friends have identified, I'm kind of worried about this person. Go ahead and go to the next slide. And so, part of that is developing if there are any risk when we assess these students. Is there any safety concerns? Let's develop a safety plan. Let's, make sure that any people that need to be notified are notified, CWS, making sure parents are informed. Hey, what's going on? How can I help support my student? Making sure that parents are aware of services that are available either on campus or off campus. And then, of course, completing any necessary school safety procedures. Next slide. So I'm going to leave you with some of these resources. We do always provide these, and we provide them on little cards as well to the students, where one side has the warning signs for depression and suicide, and the other side has these resources. So the San Diego Access and Crisis Line, that's a local resource that students, anybody can call, actually 24/7 in all different languages, and there's also a live chat and a text option. The text option isn't a robot, it's a real person speaking, which is amazing, right? A great resource, because some some children feel more comfortable anymore texting, or they feel it kind of disconnects them a little bit to where they can speak a little bit more frankly. And then 988. Now, this is a great resource if you haven't heard about it. It's the Suicide Crisis Lifeline. So it's similar to the San Diego Access and Crisis, but it's nationwide. And they do have the call, text, chat as well. So if you are worried about your student and you aren't sure what to do, you can call one of these lines and they can also walk you through it. You can also take them straight to, a hospital or an ESU, one of those things, to be assessed. Trevor Project is an amazing resource for LGBTQ plus youth. They also have live chats on there. And then emergencies, we always tell everybody, if it is an absolute emergency, of course, drop all those things and call 911. And then we also talk about PERT, how those officers are trained, especially in mental health, that might be able to help them as well. And I believe that we'll also have MC CERT as well as a resource. So thank you so much for your time, and I appreciate everybody listening in and allowing me to be so frank about this topic.
That was fantastic. Thank you, Kat. I mean it. Like your passion for this and the resources you shared are, I know, going to be helpful. So I wanted to just 5 minutes because I have Cindy up here next to me. There's two things I wanted to speak to briefly, and for some of you this will be new. Actually, maybe for many of you. One is I want you to speak to our screener, and the other is I want you to speak to Content Keeper.
So thank you. For those of you that don't know, Poway Unified has been using Columbia Suicide screening tool. It is research-based. So I'm going to mix the two together. Content Keeper is a web monitoring system that we have, and every hour on the hour, I get a report on what our students are looking up. So it'll come across if they're looking up guns. It has a keyword or a key phrase and a trigger word. So it'll say gun, and the trigger could be, how do I obtain an AK-47? Or the trigger word will be suicide, and it'll say, give me the lyrics for the Suicide Boys songs. And so we get those reports when your students are using a district device. And then, as any administrator sitting here will tell you, they get a call and it says, please call Cindy Hicks into the office. This is what came up. This is what they're searching. If any of the signs present, as was explained up here, then there is a suicide screener. It is not an assessment. An assessment is done by a licensed therapist. It's a screener. It is made for people like us to utilize. Our counselors are all trained, very good at it. And our student services specialists refer to the counselors if they're working with a student. You can look it up online. It's a series of 5 brief questions. If this, then this. And the parents are then notified. You get a very strongly worded notification. And what it does tell you is that your student has been screened. Please know that, as was mentioned here, guns is one of the top ways for suicide for youth. Please lock up your guns, ropes, medications, and we just let you know that we have screened your child. It is entirely up to you if you want to take them for further services, but we let you know that we have seen a concern concerning behavior by your student. So we are utilizing that in the district, and I don't like to say success stories, but we have been able to help families get services for their students that would have otherwise gone unnoticed.
How many searches are flagged a week on average? Let's say for this topic, mental health.
For this topic, I probably get between 100 and 125 a week.
Okay, and then of those, what number are transient in nature and what number are substantive or later discovered to be substantive? Some students are searching, you guys, because they're curious, right? You're right, like that. Some parts of this are natural, something in the news, and so they search, right? They're just like us. They're learning and observing and in an environment that's live and dynamic and in many respects interesting, right? And so not every search that relates to this is a tell, but certainly some are. So that's my question. What number are transient of that number? Because that's a big number. What number are substantiated?
So the numbers that Greg presented on where we are in 2025 all came out of Content Keeper. So you saw it was 109 at the elementary level, and I don't remember the exact numbers, but they were all by Content Keeper, where the schools were notified that the students looked something up, and that's how we found it. The other thing we're finding is they're looking up YouTube. Parents, there's YouTubes on how to die by suicide. There's YouTubes on how to take pencil sharpeners apart and use the blade in the center for self-harm. There's YouTubes, please monitor what your child is looking at. Look at their search history. You own the computer, or the school does. Look at their search history. That's what I like to say, because it tells you a lot about what the students are thinking, doing, or feeling. Thank you.
I know we love a meeting that starts on time, ends on time, and I'm going to close where I started. This is a room full of people who had a full day. So again, I just want to express my appreciation to each of you for being here, for your interest in this topic. I want to thank so many of you in this room for being leaders. Like, you're here so that you have the most current information, and so that you can, dispatch that, right? Dissipate it to your communities, to your families. So thank you. Thank you for being resourceful. Thank you for being present. Thank you for being engaged. I'm going to close just with this real quick. All of the research tells us the earlier we intervene, the better. Early intervention leads to more timely and targeted referrals, and it can help reduce the severity, the duration, and the reoccurrence of mental illness. So if you know of a child who's struggling, it could be your child or one of your children's friends, please report it to somebody, right? Like, pass along, don't just ignore it. That protocol, see something, say something, is critical. Okay, so my hope is that the information shared with you tonight was useful. I want to thank again our panelists for your passion on this topic, for your expertise. Thank you for sharing the resources you did. Can we give them all another round of applause? Can we go to next slide? Next slide. We're not going to have time for questions, but looking ahead, I just want to draw your attention to, we have a couple of things up here of interest. And then in May, which is Mental Health Awareness Month?
Yep.
Is that-
Mental Health Month. Yep.
May Mental Health Month. Just FYI, here it comes. We're going to have a student panel. So, and they're going to speak to us about this topic during that month, but their lived experience, right? And I've got both middle and high school students, as well as elementary, engaged in the Hope Squad and some of the other initiatives who will be here. So look for more information to that's coming, okay? Thank you for joining us. Have a great evening, you guys.
Putting the anxiety cards here if you want to.
We'll be up front if you have questions or want to engage with our panelists.